have so many cousin marriages, consanguinity, that we see so many rare diseases. The diagnosis is very rare, and then treatment is even rarer because the medicines are not available for rare diseases. We'll need to beg, borrow, steal, or import them from anywhere. So we are trying to eliminate the path for rare disease, and that is the reason we formed SNARE. SNARE is, alhamdulillah, a Section 42 non-profit organization with SECP, and we have an office at Aapka Clinic. The reason is that I see personally as a physician so much rare disease. And when the rare disease is seen in Pakistan, usually it is being treated as if it is being possessed, as she or he or a child is being possessed by demons or sermons, and they are beaten right, left and center, and they are subjected to fire that somebody had, they have been subjected to magic and they want the magic to go away. So Pakistan needs a call of action because we see so many rare diseases. It's this silent struggle that we need at SNARE for the unseen burden. The challenges are multiple. I will not go in detail, but because of the shortage of time. But we do have our own definition of rare disease in Pakistan. You can visit our website, which will be launched today. Again, it is we are trying to navigate the patient's journey and make it for the families and patients worthwhile. I have seen my interest in rare disease has been for the last 25 years. I've traveled along with Aftab Mohsen, Dr. Shaila, myself, in very difficult and dangerous terrain to explore the rare diseases. One, sirf Google kar lein, just Google solar kids and you will see. Now, solar kids, I'll just very briefly tell you, when I was Vice Chancellor of PIMS, Pakistan Society of Pakistan Medical Institute in Islamabad, and then I was visited by a journalist, and he told me there is a family there that when the boys, they get up in the morning, they are fine, they are going to school, they are playing hockey and cricket, but as the sun sets, they get paralyzed, and they get so much paralyzed that two of their brothers had died of the same disease because they stopped breathing, and they say they cannot go to the toilet, they cannot eat, and even it's very difficult for them to breathe. And when we went to Balochistan, very rare Balochistan, Mian Gundi, just Google and you will find it. CNN covered it, BBC covered it, and everybody. And we saw they were made to hang upside down. And they were being beaten up that there is some magic thing going on or some demons are possessed. So we tried to investigate. It took me 3.5 years to investigate and find out that it is a dopamine responsive akinesia, nocturnal akinesia. And I reported this case, and then more cases are being reported now. And they are cured, and alhamdulillah, they are now very happy, and we keep on visiting them. Last visit during Ramadan, Aftab Mohsen was with me, Dr. Shaila was with me. They were a very happy family, and we admitted them just to give them placebo. We were giving them dopamine, but just placebo, and they again got paralyzed. So we reproduced their disease at Sandyman Hospital, Quetta, during the Ramadan. And this is just one case, but I can talk of several cases, and we will be reporting this on our. So we have an advocacy program. Again, a mother who gave birth to a very rare child, a child suffering from very rare disease in Gujranwala. She is now committing her life to for rare disease. So I am very, very grateful to Aga Khan and especially Salman Karmani there. He is a wonderful resource for me. He is a younger brother to me. He does a lot of genetic work, and we are partners, and we have partnership with so many universities now, including Aga Khan. Only yesterday, Dean Adil was here, and we have decided jointly to launch a registry of rare diseases. Huma's lecture was today, but her flight problems, so her lecture on rare diseases, Huma Chima, she's our senior vice president, and Aftab is our senior vice president, and Vice Chancellor of Children Hospital, Masood Sadiq, is our Senior Vice President. So her lecture is now going to be tomorrow at 12 noon with the courtesy of Professor Azizur Rahman for 20 minutes. She brings with her loads of experience of treatment. This is how the SNARE came into being on Monday, January 13, 2025. Professor Sajid Maqbool is the currently the patron-in-chief. He is the Senior Vice President, Professor Masood Sadiq, and myself. I'm very grateful to all of them for entrusting me with the challenge of SNARE as President. Huma and our genetics, Asma, she's PhD from France. And these are just few glimpses of the first meeting. And we conduct grand rounds where rare cases are presented. We go rather on their beds. And this is, you can see Aftab Mohsen, how passionately he is looking after this child with a very, very rare disease. And you can see this, that we already. So I thank you for this, and I will only say, okay, please support this society of rare disease. Salman, so because of shortage of time, I'm sorry, I'm rushing it, but we need to create that awareness that people do not go to quacks, to people for sermons, for demons, and think they should be given treatment. Rare disease should not be treated by anybody else but people like you sitting here and myself. We have so many endocrine renal disease. Ab aap kahenge, can you ask me who are the members? We have members from all specialties, including dentistry, because they're including orthopedics, including pediatrics, including endocrinology. Jaida is our Secretary General, mashallah, and she is a pediatric endocrinologist. So all these specialties can take place. And as I said, we are launching a joint registry of Aga Khan University and SNARE together. SNARE again will try that no child is left behind without treatment or without diagnosis. Thank you so much.